Ojonoma, and I'm presenting on the topic Apheresis, the spirit, soul, and body of blood transfusion. I was mostly supervised by Eminence Desmond. I'll be guided by the following outline. Naturally speaking, when we look at a human being, we may conclude that a human is just the body that we see. But over time, we have realized that the human being is not just the body. It's a tripartite being made up of the physical body, the soul, and the spirit. Likewise, the blood. When the blood is looked at naturally, one would think it is just a red liquid component in the human body. But with scientific evaluation and investigation, we realize that the blood is made up of components, which include the red blood cells, the white blood cells and platelets, and the plasma. This also makes it to look like that tripartite being that the human is. The next slide. What is apheresis? Apheresis is gotten from a Greek word, apheresis, meaning to take away. This is a medical process that involves the selective removal and collection of specific blood components for therapeutic purpose. It is a medical technology in which the whole blood is withdrawn and then a specific or targeted component of interest is separated from the whole blood using centrifugation or membrane filtration. And then the remaining part is returned back to the donor or the patient. The next slide. There are different types of apheresis depending on the blood component of interest. We have the plasma apheresis, which involves the separation of the plasma, and then the other part of the blood is returned back to the patient. And in this case, it can be a plasma exchange or a plasma perfusion. In the plasma exchange, the plasma in this case contains a lot of harmful antibodies that are attacking the body cells, and then it also contains other harmful proteins and other antigen antibody complexes that is now causing autoimmune disease. So in this case, the plasma is harvested out of the patient and then exchanged with a normal plasma. And then we have the plasma perfusion. In this case, the whole of the plasma is not being removed, but those harmful components in the plasma is now removed using a membrane adsorption technique. And then we have the site apheresis. This involves removing of the red blood cells, in that case the erythropoiesis, or the white blood cell, in that case the leukapheresis. And then we have the lymphoapheresis, which involves the removal of lymphocytes. And then we have the combination of the lymphocyte apheresis and then the plasma apheresis, which is called the lymphoplasma apheresis. The next slide. Now we move on to looking at the symbolism. Why I have said the apheresis is like the spirit, soul, and body. In this case, I've likened the red blood cells, which is the erythrocytes, as the body. Because naturally speaking, when you look at the blood, it is just that red component you see. So it looks as if that is the body of the blood. And we know that these red blood cells carry oxygen from the lungs to tissue, and it removes carbon dioxide. The red blood cells also help in sustaining physical life and energy production. I believe we've heard that the blood contains the life of the organism, without which tissues die from hypoxia. So symbolically, the red blood cells represent the body, the physical structure that sustains visible life. Just as the body gives form and strength to a person, the red cell also gives vitality to tissues. The clinical significance or relevance of the red blood cell in apheresis. In this case, red blood cells is removed, harvested in the case of erythrocytosis, which is used in treatment of severe anemia, sickle cell disease, and other chronic transfusion programs. The next slide. The soul, which is the plasma. We know that the plasma is the liquid portion of the blood, and it carries clotting factors, hormones, proteins, nutrients, and antibodies. It also serves as a medium of communication and transport. And that's why I also liken the plasma to be the soul. Because the soul also is like a link between the body and the spirit. And it connects the thought, emotion, and will, of which the plasma also connects and transports essential substances throughout the body. It is removed in plasma apheresis. Please permit me to welcome the deputy directors at your office. And it is also used in thrombotic thrombocytopenic purpura. It is also used in treatment of autoimmune diseases and Guillain-Barré syndrome. The next slide. The spirit, which are likely to be the white blood cells and the platelets, defend the body against infection. The platelets also protect the integrity of the vascular system by preventing bleeding. Symbolically, they represent the spirit which protects and preserves life, just as the spirit guards and gives higher protection to the human person. The leukocytes and the platelets also guard against infection and hemorrhage. And the clinical significance in this apheresis, we can extract the white blood cells during the process of apheresis for hyperleukocytosis in leukemia, and it can be, for in case of platelets, during platelet apheresis for oncology, that is cancer patients, and also in treatment of thrombocytopenic patients. So this is the blood showing us the plasma representing the soul, and the WBC and platelets, the spirit, and the red blood cell, the body. So thus, the blood, like the human being, is not just a uniform entity, but a harmonized integration of distinct components. So why is apheresis needed in blood transfusion? We have seen that over the years, blood transfusion has evolved from just donating the whole blood to now targeted components for therapeutic purposes. The first is precision component therapy. Instead of just giving a patient the whole blood, that he may not necessarily need everything, but with this apheresis, the targeted component that is of interest for that patient can be utilized. Also, frequent donor ability. Apheresis has made it possible that a particular donor can even donate a particular component frequently compared to the normal blood transfusion when it donates the whole blood. In this case, a patient who donates perhaps only granulocytes can even come back maybe in the next 1 week to donate even more of that. So that's why we have frequent donor ability. And then we have higher component yield. In apheresis, more of those components can be harvested and used. Then for therapeutic disease control, just like I've mentioned in those other cases. And then it has even brought stem cell collection. Through this apheresis technology, stem cell collection has also been achieved. So this is the procedure in action, just to give us a mechanism of this apheresis. The first step is that the blood is drawn from the donor or the patient. This blood is connected to the machine that has a centrifuge inside, or a membrane filter, depending on the type of the machine used. The blood here is now separated due to the density of the various components of the blood. The red blood cell, which is the densest part, comes out first, followed by the white blood cells, the platelet, and then the plasma. And this is controlled by the centrifugal force that the centrifuge is made up of. Then the needed components are now collected in sterile bags with anticoagulants to avoid coagulation. And then the unused component is now returned back to the donor, while the needed one is transfused to the patient that needs it. Then this is a picture of a donor who was involved in granulocyte donation, giving us his feedback about the success of this process. Okay. Giving us his feedback about the success of this process, because it is of concern to some persons how safe is the donor and how safe is this procedure. Because see his feedback, he said on Saturday it was an interesting day for him, of which the procedure took within just 2 to 4 hours. He was put in a comfortable position. A movie was played for him while the process was being done. And through this, he was even able to donate more than once for this particular process. The next slide. The clinical indications of apheresis at the course of the presentation, while I was mentioning each of those components, I mentioned each of those each of those diseases that these components apheresis are being used for. So the next slide, because of time. The next slide. So some complications have been observed, although with proper monitoring, these risks can be avoided. these risks are not much. For example, the citrate toxicity that leads to hypocalcemia, this is the use of the anticoagulant that contains citrate. So sometimes because of that, if it is excess, it can take up the calcium, and this will now lead to hypocalcemia. So to a degree, the patient may have like a fainting kind of sensation, but with proper monitoring, this can be avoided. Then hypotension due to that low calcium, and then vasovagal reaction also due to the calcium. Then sometimes you could have line-related infection when the venipuncture that is used, it is not properly sterile. The next slide. So these are the innovations. Apheresis, the procedure is now being upgraded, having automated system, and even introducing AI to make it even personalized and to enhance the safety of this procedure. The next slide. We have journals have recorded that there are 75% efficacy of this procedure, and even the safety of the donor is guaranteed about 92%. The next slide. So the future direction, emerging trends in personalized therapies and AI integration promise to revolutionize apheresis and enhance patient outcome in transfusion medicine. In conclusion, apheresis is the living embodiment of the spirit, soul, and body of blood transfusion. Scientifically, it represents technological advancement and precision medicine. Clinically, it allows the selective separation and therapeutic manipulation of blood components. And symbolically, it reveals that blood, like the human person, is a unified system of distinct but interdependent parts. Red blood cells sustains the body, plasma connects like the soul, and white cells and platelets protect like the spirit. Through apheresis, medicine respects this distinction and enhances it for targeted healing. Thus, apheresis is not merely a procedure, it is the refinement and the maturation of transfusion medicine itself. These are my references. Thank you so much for your attention.
Thank you.